Hello, everyone, and welcome to the Depression and Anxiety Awareness Seminar. My name is Sade Powell, and I'll be leading the seminar today. I am a researcher and health educator from the National Alliance on Mental Illness, or NAMI for short. I have experience in researching and teaching different mental illnesses, but I focus on anxiety and depression because I can personally relate to those. My goal for today is to help you all learn how anxiety and depression can show up in teenagers. And by the end of the seminar, I want the majority of you to be able to list different symptoms as well as treatments that can help alleviate symptoms of anxiety and depression. So let's get started. So our lesson goal for today is to increase knowledge of depression and anxiety in teenagers aged 13 to 17 in Smyrna, Georgia. And we have two objectives today. One is that by the end of today's seminar, at least 75% of you will be able to identify at least 5 different symptoms of anxiety and depression. And our second objective is that by the end of this seminar, at least 75% of you will be able to list 5 different treatments that can treat anxiety and depression. So at this time, we would be doing an icebreaker or a warm up where you will write on a sticky note one feeling that you associate with depression and one that you associate with anxiety. And then we will introduce ourselves and talk about those feelings and how they align with anxiety and depression. So at this time, we'll just watch a short video that just talks about the differences between depression and anxiety.
Hey Psych2Goers, before we begin, we want to give each and every one of you a big thank you. We at Psych2Go are individuals that work hard every day to provide quality content for you all to see. Thanks to you, we are closer to reaching our goal of making psychology more accessible to everyone. Now onto the video. Anxiety and depression may be confusing, especially if the person is struggling with both. These mental disorders can be healed, meaning someone with depression can also have anxiety symptoms, and vice versa. But first, what exactly is anxiety and depression? According to medical news today, anxiety disorders occur when a person regularly feels disproportionate levels of stress, worry, or emotional trigger. While depression is a mood disorder characterized by persistently low mood and feeling of sadness and loss of interest. Living with those disorders can be challenging. Let's have a look at the different and common symptoms of anxiety and depression. Some anxiety symptoms are, but not limited to, excessive and unhealthy worry and tension, an unrealistic view of problems, a sense of impending danger and negative doom, restlessness or fatigue, the need to go to the bathroom frequently, and insomnia. Some depression symptoms are, but again not limited to, the feeling of being hopeless, a loss of interest in things or activities you once enjoyed, appetite changes and weight fluctuations, insomnia or hypersomnia, suicidal thoughts or attempts, and self-harm. Some common symptoms include two, appearing trauma, fatigue, or irritability, language impaired ability to perform everyday tasks. Both mental disorders, although different, share symptoms, making it difficult to understand which is which. The differences can be observed in how anxiety and depression manifests. Anxiety disorders are more intense in behavior. It is characterized by excessive fear and worry that in turn will affect a person's behavior. This occurs when people overestimate the danger in situations. In severe cases, people will avoid a situation that causes them anxiety. Individuals can experience sensations of impending doom or feeling on edge before things happen. If the anxiety disorder is not resolved within time, people can experience panic attacks, and their daily function can become affected. Depressive disorders, on the other hand, are oriented towards the past. People tend to fixate on negative situations that impacted them. Individuals experience diminished interest in those activities, if at all. Physically, depressed people may exhibit psychomotor retardation. This is due to some sleep-related issues. Depression also affects sleep patterns.
Okay, so after that video, we did learn about differences and similarities between anxiety and depression. So with depression, it is a serious mood disorder characterized by persistent feelings of sadness, hopelessness, and loss of interest. It can cause somatic and cognitive changes that can impact someone's ability to function in everyday life. And it can also cause difficulty in memory, thinking, eating, and sleeping. So with depression, um, there are persistent feelings of sadness, but it is not every day. Someone can be happy one day and depressed the next. Um, when it comes to depression and loss of interest, things that you normally find um, when makes you happy, like say listening to music or doing any type of hobby, that loss of interest can be, a sign that something deeper is going on. Um, there are different types of depression. So depression that is not known by everybody, just the most common type of depression, I should say, is clinical depression or major depressive disorder. And there are several different types of clinical depression, including seasonal affective disorder or seasonal depression, prenatal depression or postpartum depression, and atypical depression. Um, Another type of depression is persistent depressive disorder, disruptive mood dysregulation disorder, premenstrual dysphoric disorder, or depressive disorder that is due to another medical condition, whether it can be hypothyroidism, heart disease, Parkinson's. Um, Me personally, I do deal with it due to PCOS or polycystic ovarian syndrome. That's another medical condition that can um, cause depression. Um, and all of these do have similar symptoms. The main differences between them are the causes. Um, like postpartum depression is due to having a baby and your hormones being, all out of whack, basically. Um, Seasonal affective disorder based on the season. So most people that do have this have um, depression due to like during the fall and winter months, and once it becomes like spring or summer, their depression does, get better. And what is anxiety? Anxiety is a normal reaction to stress, um, but it can turn into general anxiety disorder where it's constant feelings of anxiety. It differs from normal feelings of nervousness and involves excessive fear. It can cause people to avoid situations that trigger them or worsen feelings of anxiousness. And it can also affect your schoolwork, job performance, and personal relationships as well. And there are several different types of anxiety as well. Like I said before, there's generalized anxiety disorder where there is um, no one cause for it. It's just um, there's no real reason for it. You just have it, unfortunately. Um, there's also panic disorder. There are specific phobias, like fear of heights, fear of bugs. Um, a major phobia that is associated with anxiety is agoraphobia, or um, just a fear of being outside. Um, and be that can also relate to social anxiety disorder or social phobia, where um, you have anxiety over certain social situations. That is one I do personally relate to as well. So um, that is a different type that can go along with like a specific phobia or phobia, stuff like that. Selective mutism is another type of anxiety, along with separation anxiety disorder, substance or medication induced anxiety disorder, post traumatic stress disorder or PTSD, obsessive compulsive disorder or OCD, and then just like depression, anxiety can also be due to other medical conditions. So, who can get depression and anxiety? Anyone is at risk for depression, developing depression and anxiety. Um, they are common among the general population, especially generalized anxiety and major depression. Um, the true prevalence is not known due to many people not seeking help or clinicians just failing to make a diagnosis. When it comes to clinicians just failing to make a diagnosis, it's more that they, how do I say this? They did not diagnose patients with different medical conditions. So some people can be diagnosed with autism or ADHD, um, and you can't. That can those medical conditions can lead to depression and anxiety. Um, but there is a stigma against this, depression and anxiety, which I will get to later in this seminar, which is a big reason why a lot of people do not seek help. Women are more likely to develop depression compared to men, um, and this can be due to, unfortunately, a lot of things, a lot of different medical conditions, again, like PCOS, different hormonal conditions, also different life stages, because, women, um, they give birth, so that can lead to the, what it is, um, depression, anxiety, all stuff like that. Um, They also are 2 times more likely to develop anxiety, again, due to different life stages. Also, this can be due to clinicians not really taking women seriously when it comes to their medical conditions. So, what can happen is that um, they are diagnosed with depression or anxiety, but they do have an actual medical condition that is leading to the symptoms they have. Um, And rates of depression and anxiety are highest among young adults aged 18 to 25. Um, Personally, this is just due to this is a big life change. You are going from, your childhood to adulthood. A lot of people are going to college, going into the military, just going through a whole bunch of different things. And it can be very overwhelming for young adults. So, depression symptoms. Um, like we heard in the video, a lot of depression and anxiety symptoms are comorbid. Um, so with depression, you may have disturbance in your sleep, loss of interest or in pleasure, um, guilty feelings or thoughts of worthlessness, energy changes, concentration or attention impairment, appetite and weight changes, psychomotor disturbances, suicidal thoughts, and depressed mood. And these differ from just regular sadness. It's not just you feel sad one day and you just get over it. This is just a constant feeling, whether it is for days, weeks, months, years. In anxiety symptoms, there are several different types. There's cognitive, where you have a fear of losing control, frightening thoughts, or poor concentration and memory. Physiological, where you have an increased heart rate, shortness of breath, or chest pain, where it's kind of like that fight or flight mode, basically. Behavioral changes, which is avoidance of threat cues or situations, restlessness or hyperventilating, and an affective, which is, you're nervous, you're impatient, you're jittery, things like that. So, what causes depression and anxiety? There's so many different factors that go into it. It can be environmental, like whether you're going through something traumatic, like losing your house, or going through divorce, things like that. It can be genetic, so you can this can if your mom or dad or anybody in your family had it, you do have an increase in developing it as well. And it could be biological as well, where similar to like genetics, you just have more of a predisposition for it. Medical conditions can cause it, whether it be cancer, stroke, chronic pain, anything traumatic like that. Um, there is more of an increase of developing depression and anxiety. Like I said before, traumatic life events like a death of a loved one, financial problems, or interpersonal difficulties. Um, Substance abuse can cause depression and anxiety. Um, and certain medications can, and we will talk about that more when it comes to the treatments. Um, so yeah. So how to be diagnosed. So your first step in getting diagnosed is to see a doctor, whether that is your primary care physician or any mental health professional, psychiatrist, psychologist, something like that. Um, so the health professional will use the DSM, or the Diagnostic and Statistical Manual of Mental Illnesses. This manual is used to basically diagnose any mental illness. It's not like, such a strict manual where, you know, if you have all this, you definitely have this. It's more of a guide for mental health professionals and doctors. Um, they do base it on your history and your physical findings. Like I said, whether that is your genetics, um, they base on your history, like your childhood. They go through any um, life events you have gone through. And physical findings, they do use laboratory studies. So some lab studies that they use can be like thyroid stimulating hormone, a complete blood cell count. Um, they do test your vitamin B12 because that can be a sign of um, having a low B12 count can be a sign of depression as well. Um, and other tests can be ordered as needed. This can be, a CT scan, testing for infections, anything like that. So depression and anxiety in teenagers. Um, there is an estimated 31.9% of teenagers that have an anxiety disorder. Um, the prevalence of anxiety among teenagers is higher for females than in males. Um, and there are an estimated 5 million teenagers aged 12 to 17 that have at least one depressive episode. Um, the prevalence of major depressive disorder is higher among teen females compared to males, and this does go in along with how just in general females are um, more likely to develop anxiety and depression compared to males. Some teenagers are at a greater risk of mental health conditions, and this can be due to any, school events, life events, things like that. Um, let's see. And the consequences of failing to address adolescent mental health conditions do extend into adulthood. So they do see, once you do have it as a teenager, it does continue into adulthood. It does make adulthood harder, basically. Like I said before, there is a stigma when it comes to mental health, which can delay treatment in people who struggle with mental health. Um, there are several things that people do say, basically saying no one wants to live like this. No one wants to feel like a prisoner of their own mind. No one wants to isolate themselves from the world. No one wants to live in constant fear, and no one wants to lose control of their emotions. Um, so the main reason I am doing this seminar is to rid the stigma of mental health, where there should be no shame in asking for help, whether it is, to your loved ones, to a mental health professional, anybody that can help you, your friends, people like that. Um, there are several treatments when it comes to anxiety and depression. Um, Several different types of medicines can help, whether that is SSRIs or selective serotonin reuptake inhibitors. Um, Serotonin or norepinephrine reuptake inhibitors, or SNRIs, atypical antidepressants, serotonin dopamine active modulators, or SDAMs, tricyclic antidepressants, or TCAs, monoamine oxidase inhibitors, or MAOIs, benzodiazepines, beta blockers, things like that. So all of these different medications do different things. Whether that is like beta blockers, where they help with more of the physical symptoms of anxiety and depression, where it's like, increased heart rate, hyperventilating, things like that. Or there are, the SSRIs and the SNRIs, which actually affect the chemical balance in your brain, helping you, whether it is, releasing dopamine, or, well, dopamine, which helps you relax and take pleasure in things, or whether that is, reducing, those suicidal thoughts, basically, that some people do have. Um, or like benzodiazepines, which can be used mainly anxiety to help with reducing those anxious symptoms, things like that. Or another treatment that is used along with medications or just by itself, just depending on the person, is therapy. There are several different types of therapies that can help. There are cognitive behavioral therapy, which is the most common. That one helps people manage their mental health issues by identifying the negative thoughts they have. And they essentially teach individuals how to understand their thoughts and behaviors and patterns. Um, this is usually the first line of treatment when it comes to dealing with anxiety and depression. Another one is interpersonal therapy. This one is a short-term therapy which focuses on improving your relationships with people to help alleviate the mental health symptoms you have. Um, it helps improve communication and problem solving, and it helps improve your social support networks as well. The next therapy, which is not as well used, but you sort of use as like a last resort, is electroconvulsive therapy, or electroshock therapy. That one uses a small electrical current and it causes a seizure in the brain. Um, it's used for severe mental illness, severe depression. Like I said, it's a last resort, and it's basically used to improve your symptoms quickly, like acute suicidality. So basically, it helps improve your short-term symptoms. Um, Usually the seizure lasts about 15 to 70 seconds, and the patient does not remember anything when they wake up. But like I said, it is the last resort just to due to, you know, the electrical currents, and, it could be more dangerous. So the prognosis of having anxiety and depression, symptoms can worsen with or without treatment. And I say can worsen with treatment because going back to the cause of it being medications, certain medications can worsen symptoms, which is why it is so important for you to talk to your doctor about symptoms you're having while on it. Because, like I said, there are so many different medications. Your doctor can switch up what medications you use to find the one that is perfect for you. Because what may work for you may not work for someone else. Um, Personally, I have gone through that where I have had to try different things just to alleviate my symptoms. Um, and certain medications do have warnings, which basically says it can cause increased suicidal ideation. And that's why I can say it can worsen with or without treatment. Um, there are also increased chances of other medical conditions like dementia. Um, it can worsen other conditions like diabetes or chronic pain. Um, there are high rates of self harm and suicide, high rates of substance abuse, and relapses are common. Um, there's no real cure for depression or anxiety. You can alleviate the symptoms, and you can get to a point where you are not depressed and anxious, but there's no one cure, like here, take a pill and it's gone. That's not how it works, unfortunately. Um, These are the resources that are available. I have included the National Suicide Prevention Lifeline and the Georgia Crisis and Access Line. Both of these are available. There's also one for the National Alliance on Mental Health or Mental Illness. This is the Georgia line specifically. And the common reasons to use these resources, if you have any thoughts of suicide, self-harm, threatening violence or harm toward others, or you're in an altered mental state that could pose a danger to you or others, um, there are the callers can link you to a variety of related services. So at this time, we will do an activity where there is a journal. You will pick one of these concepts, and you will write down, um, you will talk about it in your journal basically. That will be like your first journal entry. And I want you to hopefully keep this journal and write down how whatever you're feeling, whether that is depression or anxiety or, happy things. Just keep something to, write out your feelings instead of, keeping it inside. And there will also be an assessment at the end, and it's basically just 8 true or false questions. It should not take you so long. Um, and we will have a discussion after 5 minutes where we'll discuss the answers, um, and things like that. So, the closure. Um, what I want you to get from this seminar is that anxiety and depression is, not just a one-off thing. Like, you can't. It's so complex. It's so complex between different individuals, and it's hard to diagnose sometimes because there are so many different medical conditions that can cause it, or like I said, it's comorbid. So you can have both anxiety and depression. It's just it can be hard to deal with that. um I do want to talk about what is one symptom of anxiety and one symptom of depression. um Different ones. So what one specific symptom is of anxiety and one of depression, where they can't be the same. um and Actually, after this, I would ask, are there any final questions for me or your fellow participants? Basically, where, you know, um, they could ask me anything, whether that is any other resources, anything like that. Or if they want to ask their fellow participants, what they thought, what they got out of the seminar, that's fine. So I would just like to thank you all for attending this seminar, and I hope you all have a great day. Thank you. And these are my references as well.